Research Director. For those of you who are new to SVRI, we are the world's largest research network focused on research to end violence against women, violence against children, and gender-based violence. At SVRI, we build and share knowledge to improve violence prevention and response. And we do this through our work in four main areas: through building high quality evidence on evidence-based prevention and response strategies, strengthening capacity, promoting partnerships in the field, and influencing change. As part of our work on strengthening capacity, we offer free online courses to support researchers and practitioners in their work. These courses include Dare to Care, which focuses on self and collective care, Pathways to Research for Impact, which helps researchers create evidence that shapes policy and practice, Measuring Violence Against Children, which is a course where you can explore tools and concepts to improve the measurement of violence against children, and Foundations of Data Equity for Violence Against Women and Girls Prevention Research, which discusses equitable data practices using the Data Equity Framework. We hope you'll be able to explore these courses and that they give you practical tools, strategies, and knowledge to support your work in preventing and addressing violence. We're excited to add a new course to this lineup today, and we look forward to learning more about it from the course development team. You can scan the QR code on the screen to find the link to the course. And I'm very excited to introduce the course developers. First is Dr. Vandana Sharma, who is a public health researcher and gender equality specialist with over 18 years of experience designing, implementing, and evaluating gender-based violence and gender equality programs in development and humanitarian contexts. She's joined by her colleague who also developed the course, Dr. Rebecca Hemono, who is also a global health and development researcher with experience in randomized controlled trials and large-scale evaluation in sub-Saharan Africa. Over to Vandana and Rebecca to tell us more about this fantastic new course.
Great, thank you so much. I'm going to share some slides here. Okay, there we go. Thank you all for joining us today. It's really an exciting day for us to be launching the e-learning course today. The focus of the course is on adaptation and how to adapt intimate partner violence prevention programs for new contexts. And our organization has been partnering with the Sexual Violence Research Initiative over the last 5 years to develop practical, evidence-based guidance and tools on conducting ethical, effective intimate partner violence prevention program adaptations. The first phase of the project involved developing the IPV-ADAPT Framework, which hopefully many of you have come across. It is available as well for download on the SVRI website. And it's a step-by-step guide that helps organizations adapt IPV prevention programs to new contexts in ethical and effective ways. So in order to further strengthen adaptation efforts, we decided as a next phase of the work to create this e-learning course to really be able to dive a lot deeper into some of the fundamental concepts and to go over the steps and stages, and to also have some fascinating conversations with colleagues who are working on adaptations. Now, we know that IPV is an important global health issue affecting 1 in 3 women worldwide, and that over the past decades, we have more and more programs that have been designed, implemented, and evaluated in many settings. And this leads us to this sort of growing need to also adapt these effective programs for use in new settings. However, when we're conducting an adaptation, we really need to be careful about potential risks or conducting the adaptation in a way to ensure that the program remains effective in the new context. And so this course provides a structured approach to adaptation to ensure that adaptations are contextually relevant, culturally responsive, and impactful. And the course, as Sangeeta mentioned, it's available on SVRI's learning platform, which uses Thinkific. And there are downloadable materials as well with the course. And I'm going to give you a little bit of background on the framework as well, because that is sort of the sort of guiding tool that's used throughout the course. But I mentioned earlier that it was sort of part of the first phase of our collaboration, and it was developed through a literature review, including over 165 articles and reports. 20 key informant interviews with researchers, practitioners, and donors who had been involved with adaptations, and as well with input from key experts from diverse contexts. And the kind of cover of the framework is there in the slide. You may recognize that. But this slide here provides just the overview of what the steps and stages are in the adaptation process. So there are 5 stages that correspond to the acronym ADAPT. So the A, D, A, P, and T in ADAPT, each one corresponds to a separate stage in the process. And then within those stages, there are different steps. And the framework takes a very flexible approach to adaptation, so it's not a linear process. Now, I will play this little video for you, which will give you as well an overview on the framework and the course. And then we'll dive a little deeper into the course materials and content.
Across the world, communities are working to prevent intimate partner violence, or IPV, and many interventions have been shown to be effective. How can we adapt these evidence-based programs so they truly fit new contexts without compromising their impact? Equality Insights Lab, in collaboration with the Sexual Violence Research Initiative, presents a new online course that takes you through a rigorous step-by-step adaptation process using the IPV-ADAPT framework as your guide. Through a series of lectures, fireside chats, and exercises, you'll learn how to conduct adaptations in practice, hear real-world examples from around the globe, and explore best practices and challenges. You'll examine the key principles of adaptation, including balancing fidelity and fit, safety and ethical considerations, and systematic approaches to documenting learning. Designed for policymakers, practitioners, and researchers, this course will strengthen your skills, expand your toolkit, and equip you to adapt evidence-based programs for lasting impact. Join us and discover how thoughtful adaptation can transform evidence into meaningful, sustainable change.
Great. Now, with that, I'll pass it over to my colleague, Rebecca, who will take us through the course objectives and modules and so on.
Great, thanks, Vandana. So now that we've seen an overview of what the course is and why it was developed, we'll now walk you through some of the core objectives of the course and what we hope participants will take away. So by the end of the course, learners will be able to discuss key concepts on adaptation of IPV prevention programs, understand and navigate the stages and steps of the IPV-ADAPT framework, reflect on adaptation experiences or goals, understand common adaptation challenges and strategies to address them, and use the IPV-ADAPT framework to plan, implement, and document adaptations in real-world settings. Now, this slide gives you a high-level view of how the course is structured. So there are a total of 11 modules. We begin by grounding everyone in the IPV context and the rationale for adaptation, and then introduce you to the IPV-ADAPT framework itself. The core of the course walks through the 5 stages and steps that Vandana outlined a few slides ago that range from assessing context and selecting a program to adapt through the adaptation process itself, piloting, and then targeted implementation and evaluation. And we close with fireside chats that explore adaptation themes and apply real-world examples of adaptation. And in addition to the course videos, there are several materials that allow learners to engage more in depth with the course content. So these include reflection questions, case studies, and quizzes, and these offer opportunities to apply the lessons learned in the course and think critically about how you might use them to other adaptation projects. So for this next part of the course launch, we'll shift to connecting the framework to real-life examples to give you a taste of how practitioners approach adaptation in their own work. The IPV-ADAPT framework and course were shaped by field experiences and lessons about what works and what doesn't work in practice. And the curriculum itself draws from research evidence and implementation experience. So next you'll hear from some of our fireside chat speakers about how these concepts are applied in practice, including the real-world challenges, trade-offs, and opportunities that emerge during the adaptation process. So without further ado, I'll pass it off to Sangeeta to introduce our wonderful panelists.
Thank you so much, Rebecca. We are quite lucky to be joined by our panelists who are going to share their experiences of using the ADAPT Plus framework in their work. First, we have Shashika Ekanyake, who is a gender equality and social inclusion practitioner. She works with Chrysalis in Sri Lanka as the project lead for the collaborative evidence building for impact at scale, integrating intimate partner violence into existing health system structures in Sri Lanka, a groundbreaking project which aims to create evidence on co-creating solutions on IPV prevention. She's joined by Erin Patrick, who is the Director of Violence Against Women and Girls in Emergencies at CARE and the Global Interagency Coordinator for the IASC Gender-Based Violence Guidelines. In her interagency role, Erin oversees and coordinates global efforts on GBV risk mitigation across agencies and sectors. And lastly, we have Makrin Birungi, who is a media consultant and former award-winning journalist with deep expertise in strategic communications, crisis messaging, and human interest storytelling. She's dedicated to amplifying voices from the margins and strengthening impactful communication across humanitarian and development contexts. And I'll hand over to Vandana to moderate this panel discussion.
Thank you so much, Sangeeta. And thank you to our three panelists for being here today. I'm really excited to have the opportunity to hear more about your specific adaptation experiences. And thank you as well for participating in the course development. So each of our panelists here are featured in fireside chats in the course. And so there are much longer conversations that'll be available to you where we dig a lot deeper than we will be able to today. And so with that, I think we have three very different adaptations that we will be talking about today. And so I have different questions that I think would be interesting to discuss. And I think that we'll start maybe with Shashika to hear about your experiences in Sri Lanka. And then we will also hear from Erin on the same question. But I was interested to hear more from both of you about sort of why you decided to adapt the specific program or tool that you did adapt or are planning to adapt in your context, rather than trying to create something new. So over to you, Shashika.
Thank you, Vandana. So, I'll start with why we work for the intimate partner violence. I think it will be important to know. So, as many other countries, Sri Lanka also experience intimate partner violence as a social issue. And then when we find a solution is very hard because of the social norms and religious beliefs. And therefore, as a practitioners who are working in the ground level, we see how much it need to find out a sustainable solution. There we have our health system. We have a very strong health system, which goes until the grassroots level. And fortunately, our health system started to see the intimate partner violence as a public health issue. So then they introduced a program called Preconception Care Package by the Family Health Bureau under the Ministry of Health for the newly married couples. And that program has 8 topics which cover a little bit about the intimate partner violence. Then, collaborative with Family Health Bureau and SVRI, through our project, we try to strengthen this existing program by integrating a proven IPV prevention program from another context. Then I come to back to your problem. So, question: why we adapt a proven program rather than creating something entirely new? Because there are programs out there which has shown evidence about what works. So, and those program has adapted into different context. So rather than investing our time, resources to create entirely new program, what we wouldn't know about the results, get the program what has proven evidence and integrate into this in our context. We thought that it is the best way to find a sustainable solution. Yeah.
Thank you, Shashika. And Erin, I'd love to hear more about the GBV Pocket Guide and kind of some of the considerations around, why you decided to adapt it for the populations you did.
Yeah, of course. Excuse me. Thanks, Vandana. So the GBV Pocket Guide was originally a fully written document, which the GBV Guidelines Reference Group had produced back in 2018. And particularly as COVID really hit, we were starting to get a lot of demand from people who are working out in more remote locations, and particularly where a lot of the more, sort of traditional humanitarian staff had left. For a version of the Pocket Guide that could be used by people who had low levels of literacy or who were illiterate. So communities, in some cases, community health workers or people who were otherwise not going to be well reached by a 20-page, somewhat dense, fully written tool. I should add that the goal of the GBV Pocket Guide, for those who haven't seen it yet, is to help non-GBV specialized humanitarian actors respond safely and appropriately to GBV disclosures when they receive them. So there were also a lot of incidences, particularly during COVID, of GBV survivors disclosing to non-GBV specialists just because of the overall situation. So we had this written guide and we set about trying to adapt it for an audience with lower levels of literacy, and also to combine that with a training package that could also be used by people with lower levels of literacy.
Great, thank you so much. Now, Makrin, you've worked on the adaptation of Unite for a Better Life, which is an IPV prevention program delivered in person by trained facilitators in groups, two groups of men, women, and couples. And you worked on the adaptation of this program to podcast-based delivery in Somali refugee camps. So I would be interested to hear if you could share more about some of the challenges that you encountered, the team encountered, when adapting this kind of in-person program to this different modality through podcasts or audio episodes.
Thank you so much, Vandana, and good morning, good afternoon, good evening to everyone, wherever you are listening from and attending this webinar. Well, Vandana, you point to something that was very important, and that's the United for a Better Life. For purposes of clarity, the United for a Better Life was a program that is participatory, group-based, gender transformative. It was designed to reduce intimate partner violence and to strengthen equitable relationships. And for us, the focus was in humanitarian settings. That's why Vandana has referenced the Somali refugee camp, Dolo Ado. If I give you just a quick insight into what this program, it was initially an in-person that was delivered over 14 to 16 sessions, guided by trained facilitators who would guide the dialogues, the role plays, and the skills. So you can imagine we have an in-person, it is face-to-face. I'm able to read your energies. I'm able to see you. You ask questions face-to-face. Now we are adapting this into an audio format. And this, in adapting it, we were looking at the possibility of having an audio podcast that could be shared or disseminated among the refugee populations where intimate partner violence was actually prevalent or is still prevalent, yeah, and that was Dolo Ado. So the biggest challenge for us, or for me, was basically coming from the communication side, was looking at how do we transform this, the in-person program into an audio, which is the podcast. So, and the fear here was the possibility of losing the energy, the group energy that you would see face-to-face, in face-to-face interactions, the feedback, people asking questions and you're able to respond immediately. You're able to read the mode, you're able to read all sorts of things. And now we are turning this into a whole podcast. And also there was the fear of, would people listen? And if they were listening, there was a possibility that they are listening passively because no one is watching. And how do we make this very engaging without losing, one, the content, the storyline, plus the energy and the passion that we needed from the people that were going to listen to this podcast? And it was important also considering that the in-person had aspects of role plays, it had aspects of skills practice. How would we translate all these into audio? So we took 4 steps. I think these were critical. The first one was identifying the core components in the UBL, that's the United for a Better Life, in-person sessions, activities and sessions that we thought were very important for learning that could be addressed through a podcast without losing the essence of behavior change. That was important. So we sat as a team with my team, including Vandana, the experts, to make sure that we identified those components from the 16, right from episode 1 to this last episode, 16. And then once we had clarified, generated them, we came to step 2, which was generating the episodes. So what had appeared as sessions in the in-person became episodes in the podcasts, because as you know, in audio, we are talking about episode 1 up to the last. So we were talking about episodes. So we generated scripts. Now, the scripts, for those of you who have had an opportunity to see productions in radio, in TV, usually the scripts are very important because they guide the discussion, they guide the delivery. So these were important for us to make sure that we stuck to that in-person without losing the key components that we had identified. The third step was to make sure that we had a trained group of refugee podcasters. We call them our young podcasters of Bokolomayo. So they developed the content, they understood the content. We made sure that they understood how to record the audio, then edit the audio, and then package those podcasts. And finally, to address aspects of safety and access, it was important that we established designated listening centers where trained staff were able to test out the episodes with the community before we rolled out. So we had like focus groups who came in just to listen to the episodes that had been generated and be able to understand or identify some of the aspects that they thought possibly could be improved or actually even enhanced. And that was very important. So overall, I could say that looking back, what this whole experience, adapting the United for a Better Life in-person sessions into podcasts, taught me one key lesson, and that was that the success of any intimate partner violence or GBV tool depends far less on how well it is written and much more on how well it can be heard locally, how well it can be adapted to the local context. And the only way for us to get there is to treat communities not just as recipients of the tool that we are developing, but as co-designers. And that's it. Vandana.
Yes, thank you so much, Makrin, for sharing those insights. I'm going to ask Erin and also Shashika the same question about challenges. You both have fascinating experiences as well. So we'll start with Erin. Maybe you can tell us a little bit more about this process of adapting the written guidance into the visual form and what different challenges you encountered and how those were addressed.
Sure, yeah. So if it's okay, I'm just gonna share my screen very quickly so people who maybe aren't familiar with the Pocket Guide yet, the visual version, can just see it real quick. Um, so this is the version for South Sudan. So we actually worked in 3 countries. We started in South Sudan and then expanded to Mali and Honduras. And each of the versions is a bit different. So picking up on what Makreen said about the importance of working with communities, we work very closely with local partners, women-led or youth-led organizations in each location, and also community advisory boards to help, devise the images, ensure that they were, quote unquote, translating properly from, the core messages that were in the original written version into this visual version. I'm going to stop sharing. I think one of our key surprises from the very beginning or challenges that we needed to overcome is when we went into this process, we really thought that we would be able to create a fully visual guide with no words at all, so that people who were fully illiterate would still be able to use it. And we worked closely with a team that had expertise in adult learning and knew and were experts in understanding how to take complex written concepts and translate them into visuals. But even with that, it became clear pretty early on that it was going to be impossible to maintain full fidelity to the original messages in the guide without including at least some words. So we were forced, for lack of a better word, to sort of move away from our 100% visual goal to including a limited amount of text. So as hopefully you saw from the couple pages that I just shared, we did try to keep it as limited as possible. And then similarly, we also thought that we would be able to create the training materials also in a fully visual form. We were really hoping that we would also be able to have trainers. We trained up a cadre of master trainers that were from the community, who would then go out into their own communities to do the cascading trainings to local communities. And so we thought that by creating a fully visual training guide, we would also be able to bring in master trainers who weren't the sort of typical master trainers, but could be much more, of very local communities and local villages and whatnot. And that also proved quite challenging. So the training guide actually does have quite a lot of text for now. And so that did limit the type of master trainer that we were able to train up to people who already had, were able to read and were able to read at a decently high level. We do have hope that over time we can come up with a more accessible version. We've been, before all the latest funding cuts, we've been talking amongst ourselves. And when I keep using the term we, so this project was overseen by CARE, but the GBV Pocket Guide is an interagency resource that's overseen by the GBV Guidelines Reference Group. So the we in this case is the reference group. Thinking through, could we do audio versions? Could we do video versions? Like, how else can we overcome the barrier of that required literacy, particularly for the training piece. And then also just to add that we do have a mobile app as well that accompanies this. And so we have been able to overcome some of the challenges about literacy with the app because it incorporates audio pieces. So people who are fully illiterate can still work their way through the app. We incorporate audio and also like shapes and colors so that you don't necessarily have to read something to understand how to proceed through the app. So it was a challenge. I won't say that we overcame it 100%, but it did really force us to kind of think outside the box in ways that we didn't originally anticipate. Thanks.
Yeah, thank you, Erin. That's really, really fascinating. Now, Shashika, I'd love to hear from you as well about some of the challenges. Now, your Chrysalis is at a different stage of the adaptation compared to these other two projects. You're really at the very beginning and had undergone this process of trying to select which program to adapt for integration within the Sri Lanka health system. So I'd love to hear a little bit more from you about what that process looked like and what challenges arose as you were trying to identify an appropriate program for adaptation.
Well, Vandana, as you mentioned, we are still in the beginning of the adaptation process. So we just finished the selection of the programs. I would say the biggest challenge is the understanding your context. So I will explain it by two main reasons. The first one is the program we selected. It was first used in a Ethiopian rural context. The people are from the same community, they speak the same language, they are from the same religion. But here in Sri Lanka, it's very different. We have plantation, urban, and rural areas. Within those areas, also, we have diverse intersectionality. People come from different ethnicities, they speak different languages, they have different cultural beliefs. So, first, understand what our context, what is our people, and what we need to adapt. That is the first challenge. Understand our real context, the community, the target group, the power relationship, beliefs, and all. Then, second, not like many other, we are going to adapt this program into a existing program that also in a government sector, especially in the health sector. So program is selected, implemented by community volunteers in the community settings and they have provided incentives for the participants. But in Sri Lanka, the program is delivered by the government staff and delivered at the clinical settings and with very limited fund. So then we need to go and back and forth. Who are the delivers? How they can deliver this program? So the biggest challenge is understand your context clearly, because without understanding your context, you can't make adaptation. With how would I say, that is not be a real life situation if you don't understand the context. So it's the challenge is it made us to ask different questions within ourselves. It made us doubt ourselves actually what we know. So we did really hard work for that to understand context. Yes, that is the biggest challenge we faced until now.
Yeah, thanks, Shashika. And would you be able to share a little bit more about what the process looked like in terms of selecting the intervention? So I know for those of you who haven't seen the IPV-ADAPT Plus framework yet, that first stage includes steps around, incorporating a systematic process for identification and selection of a program that's sort of a good match. And, as you talked about within the health system, there are different constraints. There's, the intervention has to be delivered by the health workers, as you said, and there are many other constraints. And so when you sort of started this process, what did the team do to kind of decide on and select that final program that was selected?
To be honest, the IPV-ADAPT Plus framework made our life easier because it is giving a clear path to go. So it has structured process because it's 15 steps and 5 stages. So it's clearly say what you need to do. And if you can strategically use that framework with correct guidance, you can make the things come and you can get the real results. So what we did is we follow the ADAPT Plus framework, we studied it, and we get guidance and support from the experts and including you, and we always documented the process. We always go back and we refer the documents, we reflect, and whenever we make decision, that all the 3 partners we together again we revisit the decisions and we make decisions. So what we did, we selected programs, shortlisted, and then we have done there is a tool called mismatch modification table, mismatch identification table. So we use that in very strategically and correct way, and it actually framework giving a room to that also itself. We can adapt, we can do lots of things. It's give you the framework, like it's give you the framework, you can work. But the best thing is talk to others, talk with the experts, to talk with the practitioners, and learn yourself, because learning is the biggest thing. And we are still learning. Actually, we are really it is really interesting process to follow. So it is like we know the destination, we know the route. The route is IPV-ADAPT Plus framework. Then we can go in the route and find out our destination. So yeah.
Yeah, thank you so much, Ashika. And, I think we go into this in a lot more detail in the fireside chat about sort of how you used the mismatch identification table to kind of assess the different candidate programs and look at different criteria that would work within your context. So it's a fascinating discussion, and I think people will be able to access that a little more through the course. Now, Makran, I was wondering if you could share a little bit more. You started to talk a bit about this big challenge about how do you translate content that's meant to be delivered in person through, role plays, through, practicing skills and so on. How does that translate into audio content? And I'm curious if you could share a little bit more about what the final episodes actually look like. So, how did the episodes encourage skill building or help people confront some of these different attitudes and norms that were the focus of the original content?
Thank you so much, Vandana. Good question. As I said, the whole process of beginning scripting. So we had the storyline already set. We started episode 1. I remember it's all about understanding gender. And then that developed into something like relationships between in the household, the man power relations, and then communications among partners. It was like developing. But then we had this fictitious character, Bill and Fauzia, who became like the thread that bound together the episodes, right from episode 1 up to the last. This was a couple that appeared in each episode, and the importance was to build that story and place it in the context. We are adapting for a humanitarian setting. We are adapting for a community where intimate partner violence is prevalent. And we are adapting, in order to tell this story or to make it real and relatable, we had to get the voices from that same community. That's where the young podcasters of Bokolomayo came from. That was very important to ground the script, to ground the podcast, because it was being told, the narrative was all shaped by the voices that the community could relate to, the community was familiar with, that they did not think these were stories that were outside the context within which the podcasts were going to be disseminated and circulated. So that was very important. But also, most importantly, was getting this team to gain the confidence, because it was amazing that these were youngsters who had never been to a class of journalism. They had never held a microphone. They had never recorded. They had never conducted interviews. And yet within our scripts, in order to adapt that text into audio, it was very important. The main aim was to keep it lively, that it can engage, it can attract the attention and sustain the attention. So we had scripts that range from 15 minutes. The longest was about 30, between 30 and I think 45 minutes. And that was also intentional, because we know that attention span of any person can be about five minutes if something is interesting. If it's not interesting, they switch off. And that's why within our podcast, as when you say to adapt the in-person program into audio, it's very important that you understand that target audience, the audience where these podcasts are going to be played and where the podcasts are going to be disseminated. That's why one of the reasons that triggered us to come up with the formats. It could have been just, narrating the text the way it was in person. That would be boring. So bringing in the text, embedding in skits, the drama skits, was strategy, just to gain the attention. And one of the things that remains memorable for me is the jingle, because that's a jingle that came from the community itself. It was like, look here, there has to be an identity. Well, what is the identity of the Somali community when they decide to listen to a conversation? And they're like, well, there was the option of having the tea ceremony, but then the sound was very important, the ambience, setting the scene. So this group of women, they came from the community itself, and they assembled, and they came with tins, empty milk tins, holding them. And in my head, I was like, what are we going to get out of these tins? And they come because they felt now they're owning the in-person, they're owning the podcast. So the identity, you have given them the opportunity to say, you are part of this. So they came with the milk tins, and then they started, hitting them and generating a sound. And the sound became our jingle, our signature tune for the podcast. They had already owned, they had taken over. And to seal it all was to bring this same community to first listen, to test out the episodes. So episode 1, we played about 2 episodes for them. They listened, they gave us the feedback, but they were more excited to know that they were part of the process. And I think the success of those podcasts was entirely dependent on the fact that we involved them, like I said previously, as co-designers. They are part of the process. Part of the success of adaptation is getting, the sell the product and make sure that there is a trade-off. We are benefiting, they are benefiting. And that's what I can say related to how that production went. Yeah.
Yeah, thank you so much, Macrin, for sharing those insights. Now, I wanted to talk to you, Erin, a little bit about your process of documenting learning, and then also advice that you might have for others who are about to undertake an adaptation. I know you had adaptations going on in 3 countries, and there was so much learning that came out of this. I'm curious to hear kind of how you documented all of that, and then, as I said, advice for others who are about to start an adaptation.
Yeah, thanks, Vandana. So because this was the first time that we had done anything like this, learning was a key part, because we've always anticipated and still hope that these 3 versions, I should add, there's a 4th now actually from Mozambique that was led by UNICEF. It was just released about a month or so ago, so very exciting. But part of what we wanted to do from the very beginning was to learn from the process, both to see if it could be done effectively. And by effectively, I mean could we actually convey the key messages from the written version of the pocket guide in a visual format in a way that was still safe, that could still, that wasn't risking people taking the visual version and maybe not getting enough information to be able to effectively and safely respond to disclosure. So we knew that there was a certain amount of risk inherent in the process if people, misunderstood or didn't fully understand, and then would take, their more limited knowledge and try to apply it in a real life context and could potentially cause some harm. So we did, because of that, build a lot of learning throughout the process, from, how we created how we simplified the content, how we created the visual guides, how we worked with communities, what sort of, competencies were required of the trainers, how we measured that, how we measured, baseline learning of the training recipients going in, what sort of knowledge they left the training with, etc. So that's all been documented and fed into what we call a learning by design package, which is also up on our website, which is in the chat, but I'm happy to share it again if needed. So the learning by design package actually walks a user through the process of it's obviously meant primarily for the pocket guide, but could in theory be used for really any GBV tool that's written that you might want to translate into a visual version. So that learning by design package really incorporates all the learning that we had over the course of the 3 years of the project that we had in the 3 countries that I noted. As far if there's any more specific questions, just please put them in the chat. I'm happy to answer. I'm being a bit brief for time. On the advice piece, I think I'm going to sound like a broken record. I mean, clearly there's an overarching theme here about community engagement being really critical for ownership and for eventual scaling and sustainability of the tools. So fully agree with what, other panelists have said about not coming in with a tool here, we've created this for you, but we've created this with you for you to use. As I said, we worked with local partners in all 3 locations. And in addition to working with local partners, we had community advisory boards that were made up of the targeted end users of the visual pocket guides. So it included, everyone from, as I said, community health workers, local police, representatives of ministries of, children and gender, social welfare, whatever the equivalent was in the particular contexts, to make sure that they were invested in the tool, that they saw themselves in the tool, that the end product was something that made sense in their particular communities. And if you do poke around on the website, you'll see that the versions for, South Sudan, Mali, and Honduras obviously look quite different for obvious reasons. And there's one other thing I was going to say. Oh, yeah, I'm happy to report, this is really good timing actually, that we just found out earlier this week that the government of South Sudan got a grant from the World Bank to be able to drastically scale up printing the visual version of the pocket guide in South Sudan. So I think that's a good testament to I should say the project in South Sudan finished in 2023, I think, 2022 or 2023. So it's been a while since our involvement in that wrapped up. So to see the government, taking an investment from the World Bank and using it to print the pocket guide, I think is a good testament to their seeing the usefulness and the relevance of it. Over.
Thank you so much, Erin. And maybe we'll ask also Shashika to share any advice she has for others from the learning thus far in terms of selecting a program. And then following that, I think we can go, there's some questions in the Q&A and in the chat, and some of them are for the panelists too. So I think we can transition to those after we hear Shashika's advice for others.
Actually, our advice for others, as I mentioned before, understand your context, call to the people, connect with experts, connect with practitioners, and don't move to the implementation before understanding your context. So stay curious, pause and reflect. You can go forward. Yes.
Yeah, thank you so much, Shashika. And Makran, did you want to add anything? I know you've already given some advice in your previous answers, but was there anything else you wanted to add for advice for others?
Yes, sure. Possibly I left out 2 points which are important, and then I would bring them at the end. One is to engage the program developers early. That was very important because we worked with the Vandana's team. We worked with experts at the University of Addis Ababa. Worked with Dr. Jennifer. We worked with the experts because they were behind, the brains behind the in-person United for a Better Life curriculum. So it was very important to understand what they wanted to live in the original, that which does not need to change, so that we maintain the goal. The goal is to make sure that there is some behavior change. So that was very important, picking the brain of the experts, and also most importantly, bringing in modality-specific expertise. And for us, it was mainly the local podcasters of Bokolomayo, who were actually as important as the experts. And to be all honest, and that's a strong advice, that the community, the local community actually guided us through all of it, the production, the adaptation, setting the tone, the characters, even the phrases, and they grounded the adaptation in real life and not in theory as it was in the initial, the in-person. So my advice is simple: invest early in the experts, and don't forget co-creating the adaptation with the local communities. That's it. And lastly, maybe one more, just in case I have a bit of time, is planning for safety, the ethics, and access from the start, because you are going into a whole different territory. I come from Uganda. I was heading into Ethiopia, and each country, even where I come from, we are going to do some work there. This was a project, and you're working on adaptation. You're going to work with the local community there. It's very important that you have worked through all the access requirements. The people that are in charge of security, granting access, are all aware, so that you're able to go in without any interruption. So that was very important for us. And most importantly, also, the ethics that guide our work become our guiding tools to make sure that we are successful. That's it from me, Vandana. Back to you.
Thank you, Makran, and thank you, Erin and Shashika, too, for all these really interesting insights. We have a few minutes left, I think, for the Q&A. So I'm going to hand it back over to Sangeeta, who is going to kind of moderate the Q&A session. Over to you, Sangeeta.
Thanks so much, Vandana. We do have a couple of questions, and I think we can start with Laura's question, who's asking about how you can measure if these adaptations are successful, and what does like a successful adaptation look like?
Thank you so much. And I think that was meant for the panelists too. So does anyone, Erin, Makran, or Shashika, want to have any thoughts about this? And then I'm happy to also share some thoughts after.
I could jump in just briefly. For me, successful adaptation is when you have already set your goal. What's your goal? Our goal for our case in relation to adapting the in-person program into audio was to make sure that at the end of it all, we had the 16 well-scripted, very good audio podcasts that could be disseminated within the community, that could be shared far and wide. So we were not restricting it to that. So once you have a goal in mind, then you have something you're striving for. And at the end of it all, if you have the 16 podcasts, because that was our goal, coming up with the 16 podcasts to sync with the in-person program, which was 16 sessions, that was it. So the goal, if you have your goal, you have set your goal in mind. What do you want to achieve from the adaptation? Or you want to adapt to what, with what consequences, and what do you want to achieve? Once you have that in hand, then that's successful adaptation. Yeah.
Thanks, Makran. Did anyone else want to add anything?
Yes, Vandana. Though it is really early to say what is the successful adaptation really looks like to us, but I would say when when the real solution meet, that is the successful adaptation. If you could meet the real solution for your problem through the adaptation, that is the successful adaptation.
Thanks, Shashika. And over to you, Erin.
Yeah, so I mean, I touched on it briefly in my last answer, but I think ultimately for the GBV Pocket Guide, how would we measure success? I mean, at the highest level, it would be improvement in the environment for GBV survivors to disclose in the countries that we were working in. Ultimately, that's our goal, right? That's the goal of the Pocket Guide, is to ensure that when a survivor discloses their incidents of violence, particularly to somebody who wasn't already trained in GBV response, that they would be met with an appropriate, safe, supportive a response and linked to services, whatever services may exist in that location, or at least provided with basic psychological first aid if they were in a context without any specific GBV response services. I will freely admit that we have not been able to measure that yet, that impact level. Not for lack of trying, but as I'm sure I don't need to tell anybody on this call, funding for anything right now is challenging, particularly, long-term impact studies. So that's been a challenge. But we knew that, even in a better funding environment, being able to, to understand the impact over time would take a while. So we had other indicators that we were looking at, including like the degree to which the visual versions of the Pocket Guide were picked up and used, and how far they spread within the countries that we were working in, which different types of actors picked them up and used them, how many people were trained, what were the outcomes of the training, like the learning outcomes. So not necessarily the outcome of the use of the Pocket Guide, but at least the outcomes of the training. So I think we have multiple layers that we were looking at in terms of how we measure success, and we've gotten, up to a certain point and would love to go all the way to the impact level.
Yeah, thanks so much, Erin. And I'll just say a couple words too, from the perspective of the IPV-ADAPT Plus framework, and then some of our experiences from the various adaptations of Unite for a Better Life that we've done. In the IPV-ADAPT Plus framework, you'll see that some of the later stages, stage 4 and 5, have components that are about sort of piloting and then broader evaluation of the adapted program. So there's more detail within the guidance about, some strategies to measure whether your adaptation itself was successful, but also then whether the adapted program was successful. We've tried to distinguish between those two areas. And there's a theory of change for this adaptation process itself within the framework as well that shows kind of the outcomes related to the adaptation process itself, and then the outcomes related to implementing the adapted program. So I think making that distinction is helpful and interesting. For UBL, we, I guess, like many programs, have a theory of change for the program. And when we're adapting the program, we also adapted the theory of change, and then that serves as sort of the framework against which to assess outcomes. And so when we were looking at whether the adapted program worked in the new context, whether it was Cameroon or the Somali refugee camps, we had a set of indicators that were based on the theory of change. And then we also looked at community perspectives as to relevance and fit and so on. So that's how we approached it for that. Sangeeta, over to you. I think there are some more questions, but I know we're at right up at time now. So I'm just going to pass it over to you.
Yeah, I think we had a couple of questions, but we just have 1 minute left. And I think most of them have been answered. So thank you, everyone. And if you have any other questions, please feel free to reach out to us at svri@svri.org, and we can also connect you with the course developers as needed if there are any answers that we cannot provide. And Paula has in the chat put in a link of where a recording of this webinar will be available. And she will also share a link for the course. So please do sign up and take the course, and please give us any feedback on how we can improve the course in the future, and if there are any other topics on which it would be helpful to have online courses. And last but not the least, thank you so much to all our panelists and speakers for giving us your valuable time today. Thank you so much, and have a good rest of your day or evening. Bye.
Thank you, everybody. Bye-bye.